We're excited about the genomic screening program, and in a lot of our initial advertising and promotion with clinicians, it was all about prevention and genomic prediction of who's at highest risk for cancer and heart disease. And now as we approach the 2-year mark, we're after 30,000 so far enrolled, and we're targeting 50,000 by the end of the year. We're seeing somewhere around 1 in 70 people who signs up has a positive result, and that has immediate implications for the patient who's sitting in front of us, the person who signed up for this research protocol, and their family members. We do know that most of the people who have positive results don't have anything documented in their EPIC files about having either a prominent family history or a known genetic predisposition to cancer or heart disease. We are in a state where there are many underrepresented communities and individuals around the state. Rather than figuring it out on our own, we managed to develop a clinical advisory board, or a group of people that represent different programs around the state, all of whom bring with them their expertise and experience in working with underserved communities. And we're leveraging that advisory board to make our outreach, to make our advertising better. As we educate our community better, we're able to get more buy-in from those clinician and researcher, faculty and trainees. When I was in medical school, which is a long time ago, there wasn't a lot of teaching on how would you use a genetic test in clinical practice. It wasn't done back then. And so a lot of clinicians haven't particularly focused on that in their clinical practice. They're not used to it, so making that easier, and that's again where this program makes it easier. The immediate clinical impact, of course, has to focus on the positive results of CDC Tier 1 screening. The part that I'm really excited about after the CDC Tier 1 screening is the clinical reuse, the ability to have pharmacogenomics on demand for someone who's signed up, has a result. It doesn't take more than 3 to 4 minutes to have an order lead to a result. I think pharmacogenomics, we talk about it a lot, and I think what it means for patients, when I tell patients if I use that word, they don't know what I'm talking about. It's getting the right drug or the right prescription for the right person. And then clinical reuse of those DNA or exome sequencing panels to have the ability to look for cancer beyond the CDC Tier 1, or cardiovascular disease for cardiomyopathy or arrhythmia, again, beyond CDC Tier 1 for familial hyperlipidemias. Personalizing medicine, again, an overused phrase, but it's something that really matters to the patient who's sitting in front of me when I'm talking about this program.